Joining me right now, Dr. Jaime, who has joined us before as a mental health counselor. Thank you so much for stopping by. Also works with Ashford University as an associate professor. So you're familiar with college kids, and that's what we're going to talk about right now.
Okay.
So how many kids actually have, I don't know if the word is diagnosable, but that when they go to college that they really develop what would be called genuine mental health issues?
The short answer is about 1/3 of first-year college students.
Oh, it's that high?
Yes, it's very high. In fact, a recent study came out surveying about 14,000 first-year students, and about 1/3 of them had symptoms that paralleled a mental health disorder.
So as a parent, or even if there are college kids that are watching this right now, how do you know the difference between when somebody really has a mental health issue versus somebody is just going through the changes that you go through when you go to college? You're an adolescent on your own.
Okay, so it is hard to tell the difference. So you do have to be very aware and know the symptoms. But once a person starts changing, they're not liking what the normal things that they like. They tend to be reclusive. They're in their home, they're in their dorm room more. They're not coming out. They're not socializing. They're cutting off friends. Those are kind of warning signs, but I do caution people, parents, students, do things that are preventative ahead of time so that when you do have this transition, because students face it from senior year to freshman year in college, do things that are preventative so that you can cope better with all the transitional issues.
Okay, tell me some preventative things. This is the first time I heard of that.
Okay, so I would say for one, maybe junior year in high school, even if things are going great. Get a life coach, get a therapist for your teenager, because they are about to embark on major life changes. They're going to be saying goodbye to friends they've been friends with since they were little.
Oh, yeah.
That's hard. They're going to be with newfound freedom and newfound independence, right? Which they can really use that in a not good way.
I didn't use it in a bad way, but I loved my independence.
But and then work-life balance for the very first time. They're going to be managing life on their own if they have a job and they're going to school and they're managing friendships. They're managing first boyfriends and girlfriends and breakups. That's a lot. And then you got that thing called hormones that are still in the mix of all.
Yeah, really. So some of this, it seems to me that you've got to start loosening the strings a little bit when they're a junior and senior high school so they can start making some decisions on their own.
Exactly, and if they see like a therapist or a life coach beforehand, then they're learning coping skills on how to deal with stress, how to deal with depressive symptoms in a healthy way, because that's a huge problem is anxiety and depression.
You say a life coach. Now here's what I worry about, and here's what parents are saying. Wait a minute, a therapist when they're in high school and nothing's wrong with them?
Yes, because they need to learn how to cope before the crisis hits.
Can parents do that though? Can they learn those skills?
Parents can learn those skills, but the problem, I want parents to be involved as much as possible, but the problem is sometimes parents aren't cool to a teenager. And sometimes teenagers don't listen to their parents.
Sometimes?
Sometimes, right, all the time, correction. But having a third party that they can just bum ideas off or maybe talk about boyfriends and girlfriends, things that are too weird to talk to parents about that they feel. They have that outlet. So I would start there.
Okay, what's the most common form of mental health that can be defined as a mental health issue that kids go through?
I would say it's probably major depressive symptoms and then followed by anxiety. So those two definitely.
So if you have depression, anxiety follows. Do they ever get reversed? Anxiety then depression?
Absolutely. It depends on the person. Think about someone that, a student, I'm thinking of a type A personality, a girl, got straight A's, easy as pie, all through senior year. Now she goes into college and she's getting C's and she's studying and struggling, right? All of that anxiety and that type A personality, that go-getter, I don't fail, I'm a perfectionist, is now, that's not happening anymore. They're going to have a lot of anxiety about what's going on, which then could turn into depression.
Do colleges offer better help with mental issues now? But again, I'm getting back to this stereotype because I'm trying to think with my kids in college or even when I was in college a bazillion years ago, if somebody thought you were getting any kind of mental health counseling, they would have thought, well, and they would use the phrase, he's mental, or there's something wrong with him. Now, I know you try to get over that stereotype, but still, how do you jump over that? How do you make the leap?
You know what, as part of the media right now, I'm going to say it's no longer taboo. Go get help. You need help not only for you, but for your future self, your future family, your friends. Be the one that goes and reaches out. And it can be a private issue. It can be an issue you can talk about. Go get help. Find out the resources that your school has to offer. If they don't have what you need, find parents, find teachers that can help guide you. But it's no longer taboo. Go do it.
So talking about it is probably the first place place it starts.
Talking about it is the first place to start. And parents, talk to your kids. You're going to know if they're changing or things seem weird or there's holes that don't seem like they're filled. Something's going on.
Yeah.
Talk with your kids. And students, be aware of how you feel inside. And if something's not right, talk to somebody.
Freshman year, let's be honest, a lot of kids when they have depression or anxiety, what do? They go out and they get drunk because
Yes, they do.
drinking is like it's the national pastime at most colleges the freshman and sophomore year at least.
Yes, it is, and that's why it's important to be preventative, because then what we can do is get support systems around those teenagers so that when they do get depressed or anxious and they are drinking and they are independent and they're off in college, we have support systems that we can help that they know that they can go to.
You do some teaching at Ashford University, which does a lot of online.
Yes.
Is online mental health counseling at least a good start, or would you even recommend that?
I would recommend it if that's all you have, but for universities out there that are listening, I would say have some type of mentoring program because I understand it's very hard to get a whole bunch of mental health counselors into a school, right?
Yeah.
That's expensive. Have peer mentoring where students can go to other students and be mentored by them. That's a good place to start. So I would say online, yes, you can go online to look for help, but you need to be careful if it's not a resource that your school has, because anyone can put anything on the internet. Make sure you're using reliable resources.
So if somebody has a problem that is defined as being mentally ill,
Okay.
Can this just be a short-term thing and then it's corrected, or do these things often lead into something that can be long-term that could be detrimental for their life?
Absolutely both. So the first thing is it can be short-term if you've got great coping skills, if you have great support and resources into play that you're using. What happens is when you just sit on those emotions and you don't do anything about them, that something very small can turn into something that grows into years.
Is social media the place to get counseling from friends?
Social
Not so
media
much.
is not. And I warn younger college students out there, don't put all of your stuff out on the internet.
Yeah.
You can ask for help and reach out behind the scenes to friends for support, but this doesn't need to be on your Facebook scroll. How depressed you are, who you hate, who you don't like. Future employers see that. So be wise in the outlets that you're using.
Now, mom and dad, you think there's something wrong. What's the proper way to go about it so you don't turn off the kids because they think you're being nosy, mom and dad? Get your nose out of my business.
Yeah, you can be a little nosy. It's okay if you're a parent. Yeah, don't worry.
But don't you set up counseling for them. Make sure they have,
they're a part of it.
Yeah.
So I always tell, sit down with your daughter, sit down with your son, look through a scroll of a doctor that you want to reach out to. What do you like? What does your kid not like? Do they want someone older? Do they want someone more youthful?
Yeah.
So let your kids be a part of it.
Wow. Would you go back to college again if you had to? And turn
No,
back to
no, I would not. I'm done.
Neither would
I'm
I.
done.
1969, I don't want to relive that year. Dr. Jimmy Kalaga, thank you for your advice. It's always good.
Thank you for having me.